Hello everyone. Today we will discuss about the second part of diabetic ketoacidosis. In the first part of presentation in respect of diabetic ketoacidosis, we have already studied about the definition of DKA, what is its pathophysiology, how it develops, and signs and symptoms related to DKA. Now let's see what are the precipitating factors for DKA. So these precipitating factors can be divided into three categories. First one is acute illnesses, second was one endocrine disorders, and the lastly drugs. So in acute illnesses, uh, pneumonia is included, any urinary tract infection, sepsis like condition, cerebrovascular accident, myocardial infarction can be there, acute pulmonary edema, intestinal obstruction can cause decay, mesenteric thrombosis can be a reason for the decay, renal failure, heat stroke, hypothermia, subdural hematoma, and severe burns can also lead to decay. Among the endocrine disorders, acromegaly can be there, which can precipitate decay, thyrotoxicosis may be there, and Cushing syndrome may be there. Among the drugs, the most common which cause precipitation of decay are beta blockers, diuretics, immunosuppressive agents, loxapine, phenytoin, propranolol, and steroids. Let's see some triggering factor which can cause the decay. So the first and most common important cause is errors of insulin therapy. So this error in insulin therapy can be due to wrong dosage of insulin we are giving to the patient. Either we are giving in inadequate, insufficient quantity of insulin to the patient, or patient has missed the dose of insulin, or there is defect in the insulin pen device through which we are injecting the insulin. Other triggering factors are infections, which we have already studied in previous slide. That can be pneumonia, influenza, and other, and few other illnesses like myocardial infarction or stroke. Pregnancy is also a very important triggering factor for the decay. Apart from that, there are some other causes which can trigger for causing the decay. Those are alcoholism, if anybody consumes alcohol, if anybody is consuming cocaine, if someone is going through the emotional distresses, stress like conditions, if there is any trauma or a person has undergone through the surgery, any underlying eating disorder is there. Apart from that, some other medication can also cause the decay like antipsychotics and corticosteroids. Let's see what are the methods of diagnosis of decay. So we can diagnose decay through its presentations, like if any history of polyuria is there, any polydipsia, there is increased thirst in the patient person is there, vomiting, dehydration is present in the patient, otherwise he is going through any weakness, or if there is any change of level of consciousness of the person, then we will suspect that he must be having decay. Apart from that, we can diagnose through the physical signs of dehydration and other conditions, through detailed clinical history of the person, and by the examining the patient as well, and apart from the laboratory diagnosis. So these are the methods of diagnosis of decay. Let's see what are the physical signs and clinical examination of the patients of decay. So in physical signs, person may develop the poor skin turgor, and it is due to nausea, vomiting, and dehydration like conditions. Apart from that, person may also have hypotension because of these conditions, and he can have tachycardia, increase in the heart rate. Apart from that, in physical science, person can have Kussmaul respiration. So this Kussmaul respiration is effortful, exhaustive, deep breathing. So let's see what are the clinical examination in respect of person of having DKA. So person can have polyuria, there is frequent urination, polydipsia, the increased thirst will be there. Because of that, person will consume more amount of water. Person can have vomiting, dehydration, weakness, and also there may be change in the level of consciousness. Let's see what are the lab diagnostic methods. So as we know that in DKA, ketone bodies are increased in the blood and urine. So we need to assess the serum urinary ketone level, as well as we need to assess the serum beta hydroxybutyrate level. As this decay is a metabolic acidosis like condition, so we need to assess the serum bicarbonate level as well as the blood pH level. Apart from that, we need to assess the serum total body electrolyte level, as we have already studied that there is secretion of sodium, potassium, calcium and phosphorus in urine in a patient of DKA. We need to calculate the anion gap, as we are facing the metabolic acidosis like condition. Apart from that, we need to assess the blood urea nitrogen and creatinine level as well, and serum osmolality level. Apart from that, some other investigations are also required to be done, like ECG to evaluate the some severe illnesses like myocardial infarction and etc. Chest X-ray need to be done to evaluate the pneumonia like conditions and other infectious conditions. Culture of urine and sputum blood are required to diagnose the other severe illness in the body. Let's see the summary and values of diagnostic criteria for DKA. So in DKA, the plasma glucose level we always be raised, and it will be more than 250 milligram per deciliter in all these three conditions: mild, moderate and severe DKA. As it is a acidic condition, so pH will always be in acidic range. In mild DKA, it will be between 7.25 to 7.30. In moderate, from 7 to 7.24, and in severe decay it will be less than 7. Serum bicarbonate level will also be decreased, as it is a metabolic acidosis like condition. In mild cases, it will be between 15 to 18 milliequivalent per liter. In moderate, 10 to 15, and in severe it will be less than 10. Anion gap will be also be present there, and it will be more than 10 in case of mild. In moderate it will be more than 12, and in severe decay it will be more than 12. So higher anion gap will be found in moderate and severe like conditions. So there will be presence of ketone bodies in urine and serum as well. When we see the mental status of the patient of DKA, so in mild cases patient may be alert. In moderate cases, he may be alert or drowsy. However, in severe decay cases, the patient may be in stupor like condition, or he may be in coma like condition, or he may be drowsy. Let's see what are the indicators for immediate hospitalization of any patient of DKA. So first one is weight loss. If any person loses weight more than 5%, it's an indication for hospitalization. If respiratory rate is above 36 per minute, if blood glucose level are untraceable, if person goes on altered mental status like condition, for example stupor, coma or drowsy, if nausea and vomiting are persistent, and there is intractable fever to the patient. So let's see the differential diagnosis for the DKA. So as we know that DKA is a triad of hyperglycemia, ketosis and acidosis condition. So we need to differentially diagnose all these conditions from their respective illnesses or diseases. So in hyperglycemia, we need to we need to differentially diagnose the patient from other hyperglycemic conditions like diabetes mellitus, HHS, that is hyperosmolar hyperglycemic state. Person can have impaired glucose tolerance as well. In stress-like condition also hyperglycemia may be present. Ketosis can be differentiated from other form of ketosis like ketosis hyperglycemia, alcoholic ketosis, starvation ketosis. Acidosis like condition can be differentially diagnosed from other conditions of acidosis like lactic acidosis, hyperchloremic acidosis. In salicylism also acidosis like condition is found. Uremic acidosis can also be there, and some acidosis can be present due to the drug induced. Let's see the goals of management of diabetic ketoacidosis. So as we know that in DKA, dehydration like conditions are prone, and also there is disturbance in the electrolytes. So we need to resuscitate the patient by the fluids as well as by the electrolytes. There is always hyperglycemic like conditions. So to correct this, we need to provide the patient insulin therapy, as well as we need to supplement the patient by the potassium, as the potassium is secreting in the urine. Apart from that, we need to monitor the patient clinically throughout, as well as we need to provide antibiotics also if there are some infectious conditions or illnesses are related with this decay, as well as we have already discussed that insulin therapy is required, and also we need to correct the metabolic acidosis like condition, and we need to correct the acid base balance. Let's see what are the preventive measures for DKA. So these preventive measures include prompt access to healthcare. We need to admit the patient at nearest hospital. Early treatment of infections and febrile illness, which are the triggering and precipitating factor for the DKA. Glycemic control must be monitored, and proper insulin therapy is required by short and rapid acting insulin. We need to initiate easily digestible fluid diet with salt and carbohydrates. Apart from that, we need to keep home glucose and ketone meter with us so that we can monitor the level of these glucose and ketones at home only. So what are the take home points in respect of DKA? Diabetic ketoacidosis is defined as high blood glucose level as well as high ketone bodies in the urine. DKA is a hyperglycemic, hyperosmolar and hyperketotic state. Apart from that, in DKA, some counter-regulatory hormones are also increased. Those are glucagon, cortisol, growth hormones and catecholamines. DKA is most prone with type 1 diabetes mellitus. However, it can also be present in some other kind of diabetes. Although the DKA is rare in type 2 diabetes mellitus, but if it is present in type 2 diabetes mellitus, so always there may be some triggering factor along with these diabetic conditions. So we have come to the end of this presentation. Hope you have liked this presentation. Thank you so much.